Hi, my name is Karen Hodges, and I am a doctor of physical therapy who specializes in the pelvic floor. I wanted to talk today about an exercise that I give all the time, especially for patients that are struggling with urinary incontinence, stress or urge incontinence. The idea with this exercise is really to focus on identifying where the muscles are that are around the urethral opening, so we can kind of get a better idea of strengthening those muscles for really local control. This exercise is called Clitoral Nods. So I'm going to orient you on the pelvis here. Here's a model of the pelvis. Here's the pubic bone right here. And then behind the pubic bone is the clitoris. It's pretty far forward. It's kind of right past that pubic bone. There's variations in its orientation, and actually the clitoris itself kind of has projections that extend back this way. Behind the clitoris is the urethral opening, and then we have the vaginal opening. And then here's the anal opening. So sometimes if I'm having a patient do an initial contraction and we're trying to get just the pelvic floor woken up, I can give a cue that says, pretend that you're on a date and you don't want to pass gas. Most patients can get that kind of right away. Oh, they contract, they lift. But usually the contraction is back here. For obvious reasons, you're trying to kind of contract along the anal opening. For our sake, for the sake of patients that are trying to manage urinary incontinence, the urethra is pretty far forward. So in order to identify this and to get feedback yourself, what you want to do is you want to trace along the pubic bone. I often have moms do this in sitting because mostly where incontinence occurs is against gravity, but you can do this lying down if you want to start. So you're going to trace along the pubic bone until you hit kind of like a fleshy, soft area. If I'm sitting here, here's pubic bone, pubic bone, pubic bone, and then I'll hit kind of a softer area. I encourage moms to do this or patients to do this, either with just underwear on or straight on skin, so that you're able to feel a little bit better. So you've kind of coursed your way back, you're feeling, okay, a fleshy, softer area. Then what you want to do is see if you can think about nodding the clitoris back toward the vaginal opening. You might get some contraction of these posterior tissues, which is okay, but see if you can really discern with your fingers the difference between being contracted and then being relaxed with that clitoral nod. You also might notice, oh, my abdominals are tensing a lot. These are both really common compensations. Feel with your fingers what changes if you try not to tighten your abdominals a lot, or see what happens under your fingers if you try not to clench your glutes a lot. Does it get stronger? Our goal is to get a little bit more isolated. However, some patients, when they use their abdominals, they actually get a better contraction. So we start with that, and then we try to take the abdominals away just a little bit. Some patients get a better contraction if they use their posterior tissues or their glutes. We start with that, then we slowly try to take that away so that we're getting more of an isolated contraction. Usually when I start with this as an exercise, I tell moms, okay, or other patients in sitting, try to do that clitoral nod, try to do it a quick, strong contraction. You should feel it in your fingers. Then relax everything and let go. For a couple seconds maybe. Be sure that you're starting from like a relaxed place again. Then do it again, quick, strong contraction, and then let everything go. You wanna do 5 to 10 of these, really see the difference between being contracted and relaxed. Then from there, you really want to quickly bring it into function. So for example, you're having leakage with coughing and sneezing. Instead of tensing everything and actually increasing some pressure, which might increase some demand on your pelvic floor, you could just bring your hands right to that same area, tighten just like that clitoral nod exercise, and see if then you can cough and there's less leakage, or you're able to maintain the contraction under your finger. Okay, good luck.